This case was presented at a Walter Marget workshop and by a junior member. And this is a case about two brothers, so 10 and 12 years old. And when they came to see us in the hospital, they had just returned from a trip to Southern Africa, come back home, and then had fever and cutaneous lesions. So the lesions were kind of, people initially at the emergency department thought they were tick bites. So they were admitted with presumed super-infected tick bites, febrile lesions, and I saw them the next morning and I thought they're terribly sick for just super-infected tick bites. So the two brothers both had lesions on the skin, but one brother had 2 lesions on the skin, so this is unusual for that. So then I went back to the literature and looked up whether or not there are lesions, tick bite lesions, which can occur in clusters or in the same person, several lesions. And it comes up that there is one disease which does that. It's called an African tick fever, called by a Rickettsia species, which is present in South Africa. And so we started them on treatment with doxycycline, and within 1 day they were getting a lot better, coming out of bed, and their fever stopped. So this was a great case telling me on how to take clinical information, then go back and look up the literature, finding other people who have published on that area, and then going back to the patient and treat accordingly. And we've managed, so this was presented at the Walter Marget Workshop, and we've managed to publish this in New England Journal as a case report. This case was really important because it is important that people know about this special behavior of ticks having kind of several bites. Normally they bite you only once, and that's their whole meal for the next 6 months. But there are very few exceptions to this, and this is one exception. And if you do not publish this, if other people hadn't published this, I wouldn't have known. So we learned from this, published it, published the pictures, so other people can also learn from that.